So I had a session at Expo this year that I was very excited and pleased to present. And it's a program we're doing here at WVU, and we're trying to integrate both the medical teams, meaning the surgeons and the nursing staff, on how to take care of trauma patients. So we use the ACS, their asset course, because that's what the surgeons use. And then we take the nursing staff in. They get a big picture. We use cadavers. We're reperfusing them with blood, but the blood is Crayola paint that we've thinned down just a little bit. And they have to go through the scenario. So they get the scenario of a 45-year-old white male, stab wound, left lower quadrant, vital signs are this. What are you going to do? So then the nursing staff has to also get the stuff ready for what we're going to do surgically wise. So it used to be everybody just thought that trauma patients went to level 1 trauma centers, right? This day and age, and it's sad to say that anytime you turn on the TV, radio, you hear there's been a shooting. There's not only been a shooting, but now it's been a mass shooting. So we all need to be prepared to take care of trauma patients. And I grew up in the era where it was see one, do one, teach one. Well, we know that really doesn't work. We found that out. The other thing is that with trauma patients is if you work in a rural area and you don't see a lot of trauma, then you're not going to see one, do one, teach one. So you need to have those skills built in. So I wanted the attendees to realize, because we all grew up in anatomy lab, we all had anatomy as nurses. So, and most of us did that on cadavers, right? But those cadavers were frozen. So the anatomy looked, for lack of better words, dead. There was no perfusion. The colors had changed, and you really sometimes couldn't make it out. So two things then, we also found out team training is the best way to teach people, right? How many times do we look at escape rooms? Bring your team down here. Let's get them out of the escape room. That's fine and dandy, but that doesn't help me in the operating room when I'm taking care of a patient. That team needs to know what the structures are, and they need to know how to take care of that patient, the gunshot wound, the stabbing, the motorcycle accident. And by doing this, we're infusing that together so that we get all of that at one time. Start saving your supplies, because people just throw things away. If you want to teach people how to drape, then save your old drapes, because we all throw things on the floor accidentally. We all contaminate things. You can buy a dummy to start with, or a mannequin for a better word, and you can drape them out so that people actually can do those things. You can save those type of supplies. Start saving the old arthroscopy equipment, start your laparoscopic equipment. Save those things, because you can utilize those to teach with. And that's what we need to do, is be teaching with what we're going to be using, not just wait till we get in the OR and then say, oh, well, here's the equipment, now let's turn it on. No, we need to be doing that before we get people into the operating room and the surgeons are screaming. We need to make it a little more comfortable for our trainees to learn.